Thank you. Thank you. Yeah, I trained really, went to the University of Florida for the anesthesiology residency, but went for the intensive care track. At that time, the anesthesiology department at University of Florida ran the surgical ICU, the burn ICU, pediatric ICU. So intensive care was always my passion, and you never know why when you're younger and medical school and training. And now I treat patients with multiple system disorders. I transitioned out of traditional medicine really in 2000. Became very fascinated with pet brain studies and did a lot of clinical research with SPECT scans initially because they were $1,100 or so. And then by 2013, Bernie Kosar, who we treated, he's for you Miami folks, you know who he is very well. Treated him for brain trauma. He's one of the few that went public, but he ended up getting me a great deal on PET scans. So we've got over 3,000 PET scans in patients who have all kinds of neurological disorders. The common denominators I'm going to discuss, and we treat them all. And it's become a very intense practice, and it's difficult to get out and speak, but our patients end up being there 5 to 8 hours a day and have numerous infusions. To get them better would take 10 years. They've generally been everywhere else. And it's a combination of things, and Joey's just one example. I have no financial interest in any entities, commercial entities. I'm going to present Joey. Joey's mother is here as well, and we'd love to meet some of you folks out at our booth this afternoon. Joey is a 22-year-old male who was diagnosed with autism at 30 months. He had an MMR vaccine at 18 months, but began slowing him down. By 24 months, he stopped speaking, 95% or so, just any speech development stopped. When I met Joey, he had severe OCD, which he had had for years. Severe social anxiety, no impulse control, unregulated behavior, which is a medial frontal lobe thing, cognitive inflexibility, impairment, thought organization, just a lot of neuropsychological issues. Yet physically, he was working out, he was snowboarding, playing basketball. So physically, he's probably the healthiest patient I've treated from a physical perspective. But this is Joey when I met him. I want you to focus on the look. That's the look of all your OCD patients. They have an overactive anterior cingulate gyrus, which if you find their Goldilocks dose of serotonin, you calm down the normal. That's all we knew as far as causation for OCD until about 3 or 4 years ago. In females, you have to have the estradiol levels at 60 to 80 pgs per ml for serotonin receptivity. But in men, generally, serotonin elevation will calm the anterior cingulate, which causes a lot of hyperfocus on the negative OCD traits, severe obsessive-compulsive behavior, and there's just all kinds of different things. And I'm sure, how many of you folks treat pandas kids or autistic kids? You've got hand washing, you've got various things they do. Last summer we had 5 physicians' kids from around the country, all with pandas. How many of you don't know what pandas is? Pediatric autoimmune neurological disorder associated with strep. They need to remove the P. I've told Susan Sweeto at NIH that. Adults can get this too, and it's where patients get multiple strep infections or one bad strep infection and make antibodies to strep B13, and those antibodies end up attacking serotonin receptors and the dopamine D2 receptor, and that's very important in movement disorders like Parkinsonian disorders, but also for OCD, and I'll explain why in a few moments. So this is Joey taken recently in I think the Aspen airport. He took a break from our clinic, and what we've done with Joey since August 1st, we worked him up somewhat in the summer, Initial PET scans will show you, and we're going to show you sequential PET scans, why Joey could imbibe the information fairly well. He's a brilliant kid. And these patients, as some of you who raised your hands know, they take in more information than we surmise because they just can't articulate what they're imbibing. So he's a brilliant kid, and I'm hoping someday he'll become a physician. But he really hadn't done much spontaneous talking and interactions for 20 years. And so when I have learned through my own clinical research with PET scans that when patients can't grab the word, it's always the dorsolateral prefrontal cortex, the 4-second memory. When they can't make the word, you have to start thinking about the speech areas.
Hello, how are you?
Hello, how are you?
I love you.
I love you.
I'm hungry.
I'm hungry.
Good morning.
Good morning.
Really making progress.
We are making progress.
Let's go for a walk.
Let's go for a walk.
Some more food.
Some more food.
No problem, man.
No problem, man.
Take a nap.
Take a nap.
Stomach hurts.
Tummy hurt.
Hello, Dr. Sponaugle.
Hello, Dr. Sponaugle.
What's on the schedule?
What are the schedule?
Let Mom know.
Let Mom know.
Help me, please.
Help me, please.
Hello, Dr. Ruiz.
Hello, Dr. Ruiz.
Hey, Gary.
Hey, Gary.
Good.
That may not seem like much to some of you, but this child for 20 years has not been able to do any of that. And it's just very exciting. Roberta, would you stand up for a moment? This is his mother. She's... If there's a Mother of the Year award, she should have it. She's had Joey to multiple countries, hundreds of autistic doctors. He's had umbilical stem cell therapy in Panama, Costa Rica, and I'll explain why it didn't work in a few moments. It's a pattern I've seen in several autistic kids and other folks. All right, PET brain imaging, you're measuring glucose metabolism. I assume most of you know that. I am not a neuroradiologist. My first love was the heart and lungs. My second love, my second medical life since 2000 has really been the brain. We really didn't know how the brain worked before PET brain imaging. You do realize that. Those of us that are my age, this gentleman's shaking his head, we had no clue with MRI or CAT scan. Without functional brain imaging, we didn't really know what was happening. But just to give you an example of what's going on here, we did this PET scan in June of 2018. It's kind of a weird way. Strange slide. Apologize for the slides. I couldn't bring Joey into my IV room. It's generally a population of about 55 patients. And his social anxiety was so severe that he would lose it. And I actually tried one day out of my ignorance. I do a lot of amino acid therapy, and I've been doing it for 10 years or more. And I can take somebody out of a suicidal depression in usually 2 hours. And I know if that sounds braggadocious. I saw this woman going, oh, well, you can't do that with oral medications. But you can do that with intravenous IV therapy. If you know the brain regions you're treating, at any rate, the majority of the social anxiety comes from the deep limbic system being extremely overactive. And my clinical research with SPECT scans goes back to 2006 and 2007. Measure the neurotransmitters, look at the SPECT, get the symptoms. And you can find that on my website under gut-brain connection. I had more gut-brain connection work done by 2007 than most of the universities. The patients are the teachers. You just have to work and utilize precise therapeutic maneuvers and precise testing before and after. And we determined you have to have certain levels of taurine and certain levels of serotonin to calm the deep limbic system, otherwise known as the emotional center. If it's overactive, you can have severe social anxiety all the way to agoraphobia. Well, intravenously, you can correct that in about 2 hours. You don't correct the total body level, but you can change the brain's behavior within hours. It takes days with good supplements, and you just can't really do it with drugs like Lexapro. Until I became integrative, I was probably one of the top Lexapro doctors in in Tampa, maybe in Florida, I could never get a serotonin above 200. We found through SPECT brain imaging and neurotransmitter correlation with symptoms that you need at least a 600 serotonin in the average American. If patients have antibodies and beat up serotonin receptors, like some of the pandas kids, you need an 1800 serotonin level to calm the anterior cingulate gyrus, and then in the deep limbic system, those are GABAergic nerves, and the way the region is calmed is the enhancement of serotonin receptivity of GABA receptivity by both serotonin and taurine. Taurine, by the way, actually activates a subunit of the GABA A receptor, like Xanax or progesterone, or Klonopin, et cetera. So, at any rate, I brought Joey into we got the scan, I brought him into our IV room, and he just couldn't handle it. So we took him back out and had to work outpatient to calm his social anxiety and some of the issues he'd had for years. And I'll show you his initial brain chemistry pattern done by a doctor in New York, and it was just really horrendous. And I just was in a hurry to correct it. And sometimes you just have to be patient. We did fine with the IV, but then it was too much. So at any rate, on PET scans, we're looking at for hypometabolism. On the bottom row, you really want to see black, like you see over here. This is a disaster. This is all infection. It's a combination of toxins and infection. The mycotoxins, through fatty acid oxidation, saturation of the myelin sheath, they change the EMF down the axon. That's Florida State research from back in 11. And they slow down the voltage. So patients who have a myelin sheath that's saturated, whether it be sciatic nerve or brain neurons, they will have decreased nerve function. But my theory was, and now the patients have proven, is that the toxins will cause a bilateral reduction in glucose metabolism or brain activity. Infections, on the other hand, will pick a side very often, or unilateral, as we see with one heart valve out of 4 being infected. So there is some toxicity issues. There are some toxicity issues in this brain, but the majority of the light blue and the yellow is a combination of about 13 different infections. Now, you cannot stick a needle biopsy in the brain, pull it out, and put it in a culture dish. So serologic testing is the best you can do. Spinal fluid testing is a little better. Ultimately, one needs to determine what the patient's problem is. I had done enough PET imaging by the time Joey came along that I could see that this is the Broca's 44 speech area, and this right on the edge of it. And it looked like a Bartonella pattern to me, and that's just based on experience. All my patients have Lyme disease, Bartonellosis, and typically 10 other infections. You either diagnose or you don't, and it's because of a suppressed immune system. We also had, I'm going to skip to a slide. We didn't know what order to put these in. It's difficult to know. This one. We also had 4 Borrelia, not 1. Borrelia burgdorferi is the big news. It's too much in the spotlight. At least it took the spotlight off of Epstein-Barr. But there are 3 Borrelia on this test from Uniscience that actually are supposedly just in Europe. Even German scientists, I read a lot of German studies, they think these are only in Europe. Well, 60% of my American patients are a royal flush. When the red bar is over the blue, you're positive. So Joey had Borrelia burgdorferi. We got numerous protein antibodies, IgM antibodies, and we've also got Borrelia garini and Alveoli and Sensu, and then Babesia, of course, Ehrlichia, and Bartonella. This test only tests for Bartonella Hensley, which is a North American Bartonella, as you folks know. The mechanism by which we treat these infections is look at the causation of immune suppression. The majority of you have a suppressed immune system and don't know it. And I can look at you, meet you personally, look at your mucin levels, the thickness on your skin, and then estimate how much mitochondrial shutdown you have. Remember, the mitochondria run, they're the engines that run the killer cells and antibodies. So we do a lot of phospholipid therapy. Of course, we do intravenous amino acids and intravenous lipids, but we do IV phosphatidylcholine, IV ALA. And when you wake up the mitochondria, you wake up the killer cells, and you wake up the antibodies. When you pull certain toxins like trichothecene, the poisonous gas produced by black molds, out of a patient, their TNF-alpha will come up. And sadly, we see so many patients who are given drugs like methotrexate, knee-jerk reflex, which kills TNF-alpha because a physician has assumed their joint pain is autoimmune. And they don't test TNF-alpha. I was surprised. I knew the Lyme doctors weren't, because we get all these patients that have been to multiple Lyme doctors. Germans proved that tricho shuts down TNF-alpha, and we are the #1 Quest practice in the country. And the TNF-alpha bell-shaped curve has for years been 1.2 to 13. My patients have all come in at 1.2 or below. And September of 17, right after the hurricane, because CLIA forces these companies to go out and retest, reform a bell-shaped curve. If you've noticed, the bell-shaped curve on TNF-alpha fell from 1.2 to 15. It's now like 0.57 to 1.8 or something. And one of my younger doctors called Quest, got to the scientific folks and said, was it the Sponaugle wellness patients? Because my patients have changed a lot of the bell-shaped curves on various tests, particularly on environmental toxicity testing. And yeah, they said, yeah, it was. And that's very sad because the government forces them to do this bell-shaped curve. Those of you who have good immune markers, you can have a vaccine. I did a press release 2 years ago on who should have a vaccine. Vaccines aren't necessarily bad. When I got a polio vaccine as a child in the 50s, it's a good thing. But the problem is the assumption in America is that everybody has a good immune system. They don't. And they don't in the industrialized countries. And the biggest change occurred after the oil embargo in '73. And by 1980, most of the industrialized countries had their homes and offices buttoned up tight, energy efficient, and we've got gas chambers all over America. Europeans are the worst. My European patients, well, the Aussies are the worst because they actually think the mold is decorative. We joke about it. But the hidden black mold and these other molds have been in buildings in Europe for hundreds of years. One of my kids came as a top soccer player in England, up to age 13. Her father's a professional. Why did she suddenly go bedridden when she went to a 200-year-old high school? Because she has a Northern European genetics. She cannot remove mycotoxins effectively. And they had shut down her immune system, shut down her liver. I'll get this off my chest quickly. Trichothecenes have been proven at Texas Tech about 5 years ago to be 10 times more liver toxic than alcohol. You folks need to wrap your brain around that because when you learn these types of epigenetics, you realize the epigenetics are much greater than the genetics. And the SNPs you look at on cytochrome P450s mean nothing. Trichothecene toxicity makes those SNPs look like a day at the beach. Those enzymes are shut down, way more of a tricho, and then patients cannot detox the petrotoxins. Everything in this room is made of petro-based material. You do know that, most of you, I think, if you're integrative. At any rate, the mycotoxins are severely immunosuppressive. HIV shuts down the CD4 T cells production. I've seen people down to 50 with petrotoxicity. That's extremely low for an HIV patient. One mechanism, trichothecene, for example, shuts down the production of all the natural killer cells. In fact, severely trichotoxic patients can have a total white count of 2,000, 1.9. But they have bone marrow suppression. They have no antibodies because it destroys the Peyer's patch in the gut lining. The best researchers out of University of Marseille. And then they have no IgM, IgG antibodies. And obviously, these tests are worthless if you have no IgM or IgG antibodies. And many of our patients, their IgM antibodies are down at 40 or 30 or 50. And actually, LabCorp in 2014, if you were paying attention, changed the bell-shaped curve for IgM antibody from 60 to 260 to 28, the new low. And the new low for the total white count is 3.4. Some of you guys with gray hair know that would be called leukopenia, but now it's normal. If you're not paying attention to this, shame you. I called 5 Lyme doctors and said, oh my God, the young doctors aren't going to have any clue that their patients have a problem. But these guys hadn't noticed either. You need to look at the brackets. They're constantly changing. And all we're seeing is everything good, hormones, killer cells, antibodies, everything good is going down every so many years as they retest and come up with a new bell-shaped curve. So multiple things occur in these patients that I treat. It always starts with mycotoxins. Every autistic kid I've ever treated, doesn't mean there are some that don't have this gene, but the mold toxicity gene, this allows you to effectively remove mold toxins around 500%, is causing just an exponential change of Americans and all patients in industrialized nations with airtight, energy-efficient office buildings and homes. Liver shut down, kidney shut down, bone marrow is shut down, and the direct hit on the brain. So this kid was living in a basement in Aspen when he got his first vaccine, or his 18-month vaccine. Look, the virus is not dead. It's attenuated. You guys know that. The assumption is we're giving a weakened virus to a patient with a kill power up where God intended. But if you don't know how to actuate the kill power by looking at CD4, CD8 ratios, CD57, CD56, you must look at about 10 markers, including TNF alpha, before you give a patient a vaccine, or the virus is going to win. It's not the mercury. I won't debate it in here. We will run out of time. How many of you know a dentist who drills mercury every day and has for 30 years? Thank you, sir. Come up front. You have common sense. I need somebody up front. It's rare today. People get caught up in these medical myths. They propagate them at these meetings, like the methylation genetics. Did you have it since you were a baby? Why were you all state soccer? Oh, she's laughing. Come on up here. You come up. Ma'am, what's your name? I need a few people who get it right away, because other people just go and believe the bullshit. Excuse my French. My patients are so brainwashed by the time they get through 50 wellness integrative doctors. If you have methylation genetics from age 0, and you were an all-state soccer player, football, basketball, and you were a woman who wrote books and traveled countries and raised 3 children until age 40, until you moved into a 120-year-old office at University of Toronto, and you went bedridden, well, the genes were there before. Do you want 677? No. Are you getting this concept? In the vaccine, it's the virus. And when I finally put out a press release, so irritated when the ILADS people wanted to brag about a Lyme vaccine. The people with chronic Lyme have chronic everything. I've been saying this since 2011. They have toxin-induced immune suppression. The last thing they need is to be injected intentionally with an attenuated Lyme spirochete. If you measure multiple numbers and they're good, they could have the vaccine. Whether you're getting the shingles vaccine, one of my videos is about a 5-hour webinar, Double Trouble. Lyme disease and mold toxicity, double trouble for your brain. Watch that one, you'll learn a lot about what I'm talking about. We've got at least 15 PET scans on there with various issues. Joey had no immune system by the time he got his MMR vaccine at 18 months because he was in a basement. Do we blame this woman? No. Blame American physicians. Now, none of us knew mold mycotoxins were that harmful 22 years ago. I've been on top of this for over a decade. Well, actually, I guess since 2006, yeah, geez, 13 years, where's it go? You got to get on top of this. Your patients The majority of people who are of Northern European heritage have this gene, and they have no immune kill power. And then furthermore, besides the direct effect on the bone marrow suppression of killer cells, and the direct effect of destroying the Peyer's patch in the intestinal lining and with subsequent antibody deficiency, and then the trichothecene effect of destroying TNF-alpha, the primary cytokine. That's why we have focused on TNF-alpha, methotrexate. Now Enbrel just grabs it and deactivates it a week at a time. Why was that the focus? For shutting down the immune system. For God's sakes, rheumatologists need to measure TNF-alpha before they give a patient a drug that destroys it, because they'll put a patient in a wheelchair very quickly. Same with the MS patients. If the MS is all toxin-induced, saturation of the myelin sheath gives you neuropathy. You can reverse it with IV phospholipid therapy. But if it is a combination of toxin saturation of the myelin sheath and Lyme spirochetes or Borrelia spirochetes living within the neurons, which is, there's all kinds of studies, particularly from Germany on that, give that patient steroids, they will go in a wheelchair in 2 days. I've seen it many times, and it's usually the chairman of rheumatology or neurology at some university. Unfortunately, my patients tend to get to the higher mech of people. You just need to look before you treat, or you're playing Russian roulette. So Joey had 4 Borrelias and 1 Bart Hensley, but through DNA connections, we were able to find Bart bacilliformis, which is very lethal. It's a South American Bartonella, supposedly. And untreated has a 70% mortality rate. Now, Joey had spent some time in Peru. It's supposedly only in the mountains of Peru, in Colombia, in various places, but there's a lot of things that are supposedly just in South America, and, like Chagas parasite. I've been diagnosed in Americans for 4 years who've never been south of the border. I would have told you 5 years ago it's just in Costa Rica, et cetera. So dengue fever is in America. You learn from the patients. We heard in medical school, the patients are the best teachers. Not if you don't know anything, not if you don't read anything. With medical knowledge doubling every year, you have to read 20, 30 hours a week. And then you bring what people write, like methylation genetics, back to the patients, and then use deductive reasoning, and you ascertain, is that really the factor? Is it genetics or epigenetics? So this guy has Bartonella, we know, so this makes it easier. Because many times Bartonella DNA PCR testing, as well as antibody testing, is negative. Because Bartonella is an intracellular organism, as you know. Studies came out within the last 3 to 4 months from a consortium of scientists who were saying, just not that big a deal, self-limiting. They've now proven Bartonella is an intranuclear organism and has a really crude mechanism of injecting its DNA into our DNA. So you can't take a kid who's already excitable and use a shotgun and blow up a lot of these bugs with a drug like doxycycline. It would just be ignorant. So we had to use a rifle, and I wrote all this in a long note to Roberta and my staff, and so we went after the speech center first, because that was the thing Roberta brought him to before. He hasn't been able to speak spontaneously for 20 years. So in looking at all this disaster, which is a combination of viral infections, Borrelia, et cetera, the giveaway was the left lateral view and this area right there. So we started out with intravenous Levaquin. But I told Roberta, with this much infection, it's one of the worst I've seen. He'll be there for several years if we can get him speaking and get everything taken care of without amniotic fluid, antibodies, and exosome therapy for healing. People in my clinic hear me walking through the aisles of the chairs and say there's no healing with killing. You're just blowing things up. You get spirochetes, Borrelia, mycoplasma intracellular, chlamydia obligate intracellular. These bugs When you kill them inside the brain neurons, what do you think is happening to the brain neurons? But if you don't kill them, they keep having babies, don't they? And if you get patients, as I do, who've had multiple scans for multiple years, you can see how the Lyme infection in the cerebellum grew from one small section in the right cerebellum, crossed over. We've got lots of these. You'll see some of these on that video I told you. Just look for my name and double trouble, and you'll see. Double trouble for your brain. So we used the IV level. We'd already used intravenous glutathione to pull out toxins. And I just want to skip over this for a moment. It's so difficult to tell you. We left most of it out for a 45-minute talk. But to give you an example, methylethylbenzene, if you live in LA, you're going to be at 14,000 on average. I've treated quite a few Hollywood folks. Only a couple have gone public. It's really that bad there. Anybody from LA today? You can validate. If you live up on the hills, you can see it, can't you? And surprisingly, Salt Lake's very terrible when they get inversions in Denver. But if throughout the Canadian and American public, the worst 5% of folks are at 7,000, that's an 800 percentile deal. This is why stem cells didn't work in Joey. This is just one of as many industrial toxins. They destroy the stem cells. He had some of the best stem cell treatment you could get in Panama. Didn't work. Didn't work intrathecal. These toxins are not simply in the blood. You measure them mostly in the urine. They're in the spinal fluid as well. They're bathing the myelin sheath, and they're going to destroy the stem cells as soon as they go in. And this is the piece that's missing with stem cell physicians. They don't know the environmental toxicities. We can show you, I spend hours showing you graphs. We don't have the time. Perchlorates, maybe you haven't heard of it. Look it up if you don't know what it is. 700th percentile. I mean, I'm talking multiple chemicals that were 2, 3, 5, 7 graphs off the graph. This is not that unusual for my clinic. So the deal is that when trichothecene shuts down the liver enzymes, cytochrome P450s, and in the phase 2 enzymes, ochratoxin, as you know, most of you probably, I hope, that ochratoxin from musty molds became famous first for kidney failure. Well, we shut down and, use GFR for God's sakes. Don't use creatinine. You can lose 50% of your GFR, drop from 120 to 60 before the creatinine pops over 1. So with the kind of exposure that people are getting throughout hotels like this one and homes, and the worst places are the ICUs I worked in. How many of you seen buckets in hospitals and mold hanging out of the vents? And they never open the windows. The sickest buildings in America are hospitals. They never diffuse the indoor air with outdoor air. So anyway, you lose the kidneys and the liver, their ability to detox appropriately, that's when you see all these other strange petrochemicals. And the woman in Cincinnati says, well, I live in the suburbs. How can I have all these chemicals? Well, have your husband check where your water comes from. The Ohio River. You're laughing again, sir. Come on up here. Because there's 50 chemical plants on the Ohio-West Virginia border that the water goes through. That's after it goes through Pittsburgh. You two, both of you, got to come up here. You're fast. So the point is, you have mycotoxins with direct shutdown of the immune system, and it's all over America. Then they shut down the detox capabilities of the patient, add the petrochemicals that also cause tremendous shutdown of the bone marrow production. My lowest CD4 T cell count of 50 was actually one of the BP victims. On the video, you'll see Dennis, who his wife had to spoon feed, and you'll see him slalom skiing at the end, but that didn't happen in a month. It requires multiple infusions a day. We detox the brain and the nerves and the cells every day with IV phospholipids, glutathione. We have to use higher levels of glutathione because we have higher levels of toxins being mobilized. Then the immune system starts to bust biofilm that these guys have made for years because they've had no immune system to kill them on contact. When these protozoan and viruses and Borrelia spirochetes are injected, they should be killed on contact. And that's what your grandparents and great-grandparents did. So we have all these infections that love the brain. We start out, I'll go back to this and stay with it for a while now. We hit the speech center with leviquin. We start the exosome therapy. The amniotic fluid's loaded with antibodies. The blood smears have tremendous protozoan in them. Toxoplasmosis is the most common. It's the smallest one, but there are hundreds of them. You look for little round circles of light blue. There's one. You look for light green circles with a yellow background. Those are protozoan of various types. We didn't go after the protozoan because when you use the herbals that I designed for parasite kill, you end up killing intestinal parasites, and they're saturated with toxins that they've been sucking out of the patient's bloodstream or the blood vessels that line the intestine, so it becomes very tricky. So one thing at a time. The clearing between August 1st started this brain to that brain and this brain to that brain was leviquin and some zithromycin for the Bartonella, but we did nothing for a lot of these other infections. And he began to speak. Yes? Yeah, oh, we've completed that? Okay. All right. Well, there's always too much. Can I say one more thing? One more? All right. Second brain scan, we still had a problem with the right caudate nucleus. I'm just going to go to the numbers if I got no time left. Caudate nucleus is a motor region. Notice the asymmetry. The computerized calculation will show you the right caudate's infected. It is typically Borrelia, sometimes it's Bart, but I assumed it was a guess. It's based on experience. His right caudate was infected with one of the four or all four Borrelia, but we did not go after Borrelia in this time period. We did between the second and third PET scan. Notice the caudate nuclei have come up to even, and it's actually negative. They're very active. Caudate nucleus underactivity on one side or both sides causes OCD, and that's the piece we were missing until 3 years ago. It's not simply a motor braking region, a sister region of the substantia nigra. So when you have infected caudate or caudate shut down by toxins, there's an OCD you cannot get rid of by raising serotonin levels and quieting the anterior cingulate. Notice when we get over here, there is no OCD. Notice that the anterior cingulate is barely overactive. We had it quieted by the first PET, and that's how I knew. By raising serotonin, before we brought him in-house per se, treated him outpatient, we had quieted his anterior cingulate by raising the serotonin from 44 to around 900. So the OCD that was extreme at this point, almost couldn't get him in the PET scan, was coming from the caudate nucleus. Too much for 45 minutes. There's a lot more details I'd like to show you, but hopefully you get a picture that, go home with these points. Don't assume you have a good immune system. Don't assume your patients do. If you come to our booth later this afternoon, I'll tell you what you need to test. You need to get tested for mycotoxins and petrotoxins. Depends where you live. And that's the problem. That's causing the just exponential surge of psychoneurological disorders, including bipolar, et cetera, et cetera. So, thank you.
Very much. Thank you.
Thank you. Take care.